Hello everyone, my name is Yash Patel. Today's topic is medical coding. The medical coding involves the transformation of the healthcare diagnosis, procedures, medical services, and the equipments into standardized alphanumeric codes. These codes are primarily used for the billing and tracking medical services. The practice plays a pivotal role in functioning of the healthcare facility and they impact patients care research and the policy making. The first one is the historical background of medical coding. Development the concept of the coding can be traced back to the 17th century when the John Grott classified the cases death of in London. The modern medical coding, however, began to the early 17th century when the international classification of the disease was first developed. The ICD codes evaluation. The codes were initially used for the epidemiological purpose and to track mortality rates over time. They expand to include disease and health conditions. Now used to globally in various healthcare settings. The introduction of CPT codes. The American Medical Association introduced the CPT procedural terminology in 1966. The primary for documenting surgical procedures. The system has since involved to cover all medical procedures. The types of medical coding systems. The most widely used in medical coding they are healthcare includes first one is international classification of disease, the development and the maintained by the World Health Organization, used for coding and diagnosis and reasons for healthcare visits. The latest version of ICD-11 was adopted in 2019, thought many countries still use. The second one is the current procedural terminology. The managed by the American Medical Association, used to code medical procedure and the services for outpatient and ambulatory settings. Include three categories: evaluations and the management, surgery and laboratory services. The third one is the healthcare common procedure coding system, developed by the Centers for Medicare and the Medicaid Services, used for coding non-physicians service like ambulance rides, medical equipments, and the certain medications. It consists of two levels, level 1 and level 2. The fourth one is diagnosis related groups, a system to classify hospitals cases for billing purpose, used primarily in inpatient settings for determining under Medicare assigns the payment weight to cases based on diagnosis, treatment, and the patient's characteristics. The fifth one is ICD-10 procedure coding system, used specifically for coding the inpatient hospital procedure in the US, provides a high level of detail for a complex inpatient procedure. The medical coding process. In the process which require the precision knowledge of the medical terminology and the understanding of the coding guidelines. The medical coding analysis coders start by reviewing the patient's medical records, which includes physician's notes, lab results, and the imaging studies and clinical documentation. The code selection, coders select the appropriate codes using coding manuals and the software systems. The codes assigned must watch documented clinically care accurately. The claim submission, once the codes are signed, they used to create claims which are submitted to ensure companies or other payers for reimbursement. Fourth one, importance of accurate coding. The financial impact. Incorrect coding can lead to reject claims loss of revenue, and the overpay payments, which can significant financially for healthcare providers. Legal and ethical compliance. The proper coding ensures the compliance with healthcare laws such as the Health Insurance Probability and the Accountability Act and reduce the risk of legal action due to fraud and abuse. Reporting, quality reporting, the accurate coding of contributes to data collection for healthcare research, quality measurements, and the health policy development. Thank you.